It's horrific because there's no training for it.
I would like to think we're never going to experience anything like this again.
I've had some sleepless nights really because I've wondered have we done enough?
They've lost residents to COVID, they've faced an obvious risk themselves, and the trying times continue. Simon moved into nursing after years in the army, the past weeks and months of the pandemic bringing a whole new challenge.
I don't think there's ever been a night when I haven't gone home and cried. Certainly during when it was the first part of it, when it was really extreme. I've got a young daughter at home, I've got a wife at home, and it's going into work knowing that it might be the case that you come out with a life-threatening virus and not knowing whether you're going to survive, whether you're passing it on to your partner or your young child.
Donna is the manager here, leading a team on a steep learning curve.
People were scared, people were frightened, staff, you could see the fear because nobody really knew what we were dealing with. And on this one I've not had all the answers, which is really frustrating. And you go home and you reflect on what's happened because you want to be there for your staff. You want to make sure that you do have the answers, and unfortunately in these times it's been tough.
And for the home's owner, Mike, an overview of the pressure the system is under.
You feel for the staff because they see what was going on in the NHS. Then we're asking them to put themselves in the front line too. So you wonder as an employer, am I asking too much? Am I doing the right things? We followed government advice, we got PPE in, we gave them a pay rise to help them. But I always think there's more we could have done and could do. The war is not over. The first battle might be won, but we're still in the thick of it. Our biggest fear now is preparing ourselves for perhaps a second wave, which I feel is inevitable, particularly as lockdown's being eased very, very soon. Personally, I think that's a bit too soon.
And in times like no other, thoughts of lasting change.
The morale seems to have actually got better. I think people have pulled together as a team. I think they're working hard together as a team.
Everybody's protecting everybody. Each staff member's looking out for each other. So yeah, I think they've built some real good relationships up.
The key thing now is to give support so we can fight the disease, but also to make sure we learn the lessons so we don't repeat it. That's the key thing. So it's sad because that's someone's mother, father, sister, brother that we've lost, and it's dreadful.